More than 6 million people in the U.S. live with plaque psoriasis, which can appear in awkward places and cause a great deal of discomfort. Dr. April Armstrong is the Associate Dean for Clinical Research at Keck School of Medicine at USC, and she joins us now with suggestions for helping people manage this disease. Welcome.
Thank you for having me, Elsa.
I'm happy to have you here. So I want to start with the basics. What exactly is moderate to severe plaque psoriasis, and what are some of the symptoms that we should be on the lookout?
Moderate to severe plaque psoriasis is where patients develop these red, flaky, and potentially thick patches and plaques anywhere on their body. It can occur anywhere from the scalp to the elbows, knees. Sometimes it can occur in critical areas such as the face as well, or the hands. The symptoms to watch out for are itching, pain, and when the plaques are thick, they can actually bleed as well.
Oh my goodness. And so how can this impact your patients' daily lives?
Yeah, so we did a recent survey of 500 patients with a moderate to severe plaque psoriasis. And what we found is that a lot of patients have flaking, that's pretty constant. And they also avoid social interactions with other people in fear that other people may interpret their psoriasis as something contagious, which we know that it is not. We also found that about 25% of patients actually experience bullying as a result of having their psoriasis. So as you can see, it has a tremendous impact on people's daily lives.
Yeah, it's really heartbreaking, but there is hope and guidance for patients who are looking for treatment options. Can you tell us a little bit about those?
Absolutely. The American Academy of Dermatology and the National Psoriasis Foundation have published treatment guidelines for these patients. And for those with moderate to severe plaque psoriasis, they recommend biologic agents as among the first-line treatments for them. And what they are, they're really protein-based therapies that can really significantly reduce the amount of redness, itch, and pain for our patients. One example of that is Ilumya, which is a medication that doctors such as myself can give in the office 4 times a year, and patients oftentimes experience significant improvement in their moderate to severe plaque psoriasis. Most of these treatments are well tolerated. Some patients may experience some injection site reaction or upper respiratory infection or diarrhea. Overall, I would say the future and the current state both look great for our patients with moderate to severe plaque psoriasis because the number of options that we have available to them, not only in terms of the biologics, the injectables, but also the oral options as well as phototherapy.
And are there any risks or side effects that patients may experience from the treatments for plaque psoriasis?
Yes, so I spoke earlier about some of the potential side effects for biologic agents. For our oral treatments, it really depends on the medication. For example, for methotrexate and oral medication, we may want to watch out for side effects with the liver, with the lungs, with the bone marrow. Overall, I think the trend has been for our patients with moderate to severe psoriasis to consider biologics because their efficacy is really good and they have a quite tolerable of a safety profile.
Okay, great. And where can we go for more information? What's that website again?
Yeah, for more information, you can go to ilumya.com. That's ILUMYA.com.
All right, Dr. Armstrong, thank you so much for being with us. Really appreciate it. And we'll be right back with more Midday Maryland right after this. Stay tuned.